Hello and welcome back to my channel. Today we'll be exploring a condition that can be both painful and disruptive to everyday life, chronic pancreatitis. This long-term inflammation of the pancreas can interfere with digestion, nutrition, and even blood sugar control. If you or someone you care about has been diagnosed with chronic pancreatitis, or if you're experiencing unexplained abdominal symptoms and looking for answers, this video will provide a clear and thorough overview. We'll cover what chronic pancreatitis is, its symptoms, how it's diagnosed, conditions it can be confused with, and how it's managed over time. Let's start by understanding what the pancreas is and what it does. The pancreas is a gland located in the upper abdomen behind the stomach. It plays two essential roles in the body. First, it produces enzymes that help break down food in the digestive system. These enzymes are released into the small intestine to help digest fats, proteins, and carbohydrates. Second, the pancreas produces hormones, including insulin and glucagon, which regulate blood sugar levels. Chronic pancreatitis is a condition in which the pancreas becomes persistently inflamed, leading to irreversible damage. Over time, the inflamed tissue is replaced by scar tissue. This scarring interferes with both the digestive and hormonal functions of the pancreas. The result can be malnutrition, weight loss, chronic abdominal pain, and even diabetes. Unlike acute pancreatitis, which comes on suddenly and is usually reversible, chronic pancreatitis develops gradually. The inflammation can smolder for years, slowly damaging the pancreatic tissue. The changes that occur in chronic pancreatitis are permanent, and while the condition can be managed, the damage itself is not reversible. There are several causes of chronic pancreatitis. In many cases, long-term alcohol use is a major factor. Drinking alcohol over a period of years can cause repeated injury to the pancreas, eventually leading to chronic inflammation. Smoking is another risk factor and appears to make the condition worse or increase the likelihood of complications. Genetic factors can also play a role, and some people inherit a tendency toward developing pancreatitis. This is especially true in younger individuals. Other causes include autoimmune pancreatitis, where the body's immune system attacks the pancreas, conditions that block the pancreatic ducts, such as gallstones or tumors, high levels of triglycerides in the blood, and chronic use of certain medications. In some cases, no clear cause is found, which is known as idiopathic chronic pancreatitis. The symptoms of chronic pancreatitis can vary depending on the stage of the disease and how much of the pancreas has been damaged. The most common symptom is abdominal pain. This pain is typically located in the upper abdomen and may radiate to the back. It can be mild or severe and may last for hours or even days. In some people, the pain is constant, while in others it comes and goes in waves. Eating fatty meals or drinking alcohol often makes the pain worse. As the disease progresses, the pancreas loses its ability to make digestive enzymes. This leads to symptoms of malabsorption. People may begin to lose weight unintentionally, feel bloated, or have frequent greasy, foul-smelling stools that are difficult to flush. This type of stool is called steatorrhea and is a key sign that the pancreas is no longer producing enough enzymes to break down fat. Another consequence of chronic pancreatitis is the development of diabetes. This occurs because the pancreas also makes insulin. When enough of the insulin-producing cells are destroyed, blood sugar levels rise. Unlike type 1 or type 2 diabetes, diabetes caused by pancreatitis is sometimes called type 3C diabetes, and it can be especially difficult to manage. Other symptoms of chronic pancreatitis may include nausea, vomiting, fatigue, and poor appetite. Over time, people may also become deficient in fat-soluble vitamins such as A, D, E, and K due to malabsorption. So how is chronic pancreatitis diagnosed? There isn't a single test that confirms chronic pancreatitis in every case. Diagnosis usually involves a combination of clinical history, imaging studies, and tests of pancreatic function. Your doctor will begin by asking about your symptoms, lifestyle habits like alcohol use and smoking, past episodes of pancreatitis, family history, and any weight loss or digestive issues. Blood tests may be done to check for elevated pancreatic enzymes, but in chronic pancreatitis, these levels may be normal or only mildly elevated. That's because the pancreas may no longer produce enough enzymes to show a strong response on lab tests. Imaging plays a crucial role in diagnosis. One of the most commonly used tests is a CT scan of the abdomen, which can show changes in the size and shape of the pancreas, areas of calcification, or scarring. MRI and MRCP, or magnetic resonance cholangiopancreatography, are also useful tools. These tests provide detailed images of the pancreatic ducts and can detect strictures, dilatation, or blockages. In some cases, an endoscopic ultrasound is performed, which involves passing a small ultrasound device through a scope placed into the stomach to get a very close image of the pancreas. There are also tests that assess how well the pancreas is working. A stool test can measure the amount of fat in the stool, which may indicate malabsorption. Another stool test measures elastase, an enzyme produced by the pancreas, and low levels suggest reduced enzyme output. Breath tests and secretin stimulation tests may also be used in specialized settings. Diagnosing chronic pancreatitis early can be challenging. The changes in the pancreas may not be visible on imaging until the disease has progressed. This is why the clinical history and a high degree of suspicion are so important, especially in people with risk factors like heavy alcohol use or a history of repeated episodes of acute pancreatitis. Next, let's look at some of the conditions that can mimic chronic pancreatitis. Several disorders can produce symptoms similar to chronic pancreatitis, and part of the diagnostic process involves ruling these out. One of the most important differentials is pancreatic cancer. Both chronic pancreatitis and pancreatic cancer can cause abdominal pain, weight loss, and changes in digestion. Imaging studies help differentiate the two, but sometimes a biopsy is needed to rule out cancer. Gallbladder disease, especially chronic cholecystitis or gallstones, can cause upper abdominal pain that resembles pancreatitis. The pain in gallbladder disease is often right-sided and may come after eating, especially fatty meals. Peptic ulcer disease and gastric reflux can also present with similar symptoms. These conditions cause pain in the upper abdomen and are often linked to diet and stress. Another consideration is irritable bowel syndrome, or IBS. While IBS typically doesn't involve weight loss or malabsorption, it can cause abdominal discomfort and changes in bowel habits that overlap with early pancreatitis. Autoimmune diseases like lupus or celiac disease may also cause gastrointestinal symptoms and should be considered if the clinical picture doesn't clearly point to chronic pancreatitis. Now let's talk about how chronic pancreatitis is managed. There is no cure for chronic pancreatitis, but with proper care, symptoms can be controlled and complications can be minimized. Management involves addressing the underlying cause, relieving symptoms, preventing malnutrition, and treating complications. The most important lifestyle change for people with chronic pancreatitis is to stop drinking alcohol completely. Even small amounts of alcohol can worsen inflammation and accelerate damage to the pancreas. Quitting alcohol can reduce pain and slow the progression of the disease. Smoking cessation is equally important, as smoking contributes to the progression of chronic pancreatitis and increases the risk of pancreatic cancer. Pain management is often a major challenge in chronic pancreatitis. The approach usually begins with non-opioid medications such as acetaminophen or NSAIDs. If pain is severe, stronger medications may be required, but doctors are cautious with long-term opioid use due to the risks of dependence and significant side effects. In some cases, antidepressants or anticonvulsant medications may be used to help manage chronic pain, which have been shown to be quite beneficial. Nerve blocks and celiac plexus injections are options for people with severe, persistent pain that doesn't respond to medication. Digestive enzyme replacement is a cornerstone of treatment. Because the damaged pancreas cannot produce enough enzymes, patients are often prescribed pancreatic enzyme supplements to be taken with meals. These supplements help the body absorb nutrients and reduce symptoms like bloating and steatorrhea. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, Nutritional support is essential. Many people with chronic pancreatitis become malnourished. A high-calorie, low-fat diet may be recommended, and supplementation with fat-soluble vitamins and minerals such as calcium and magnesium is often necessary. In some cases, working with a dietitian can make a big difference in managing the condition. If diabetes develops as a result of pancreatic damage, blood sugar must be carefully monitored and controlled. This type of diabetes may require insulin or other medications and can be more unpredictable than other forms of diabetes. In some cases, surgery or other procedures may be needed. If there are blockages or strictures in the pancreatic ducts, endoscopic procedures can help open them. Surgery may be considered for people with severe pain, localized disease, or complications such as pseudocyst or bile duct obstruction. Regular monitoring is important in chronic pancreatitis. This includes checking for nutritional deficiencies, monitoring weight, and watching for signs of diabetes or other complications. Patients may undergo periodic imaging studies to assess disease progression. Chronic pancreatitis is a serious condition that can have a major impact on quality of life, but with the right medical care, many people can manage the symptoms and live well. If you've been diagnosed with chronic pancreatitis, working closely with your healthcare team, making healthy lifestyle changes, and following your treatment plan are the best steps you can take to feel better and prevent further damage. Thank you for watching. As always, take care of yourself and make the most of your day.